The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we're getting healthy with Springfield Clinic. And joining us today, we have a special guest here. We have Dr. Penelope Eubank, an allergist over there with Springfield Clinic. She's at the one location there on Big Hollow in Peoria. Thank you so much for joining us today, Doctor.
Glad to be here.
Well, we're heading into fall season. Allergies, of course, are big right now. What are we seeing what are the big things that we're seeing right now? And kind of how are allergies different than hay fever? What's coming into you right now?
Well, we certainly do see a lot of hay fever as allergists, nasal and eye allergy symptoms. And it's not just a nuisance. It can really have a big effect on quality of life. But as allergists, we also see hives, chronic sinusitis, immune deficiencies, eczema, and of course that allergic inflammation doesn't just affect the eyes and the nose, but also the lungs. And in the lungs, that's asthma.
Is asthma, is that a lifelong diagnosis? Is it treatable? Is it curable?
It's often lifelong. So inflammation in the airways causes episodic shortness of breath, tightness and wheezing, and even coughing. That's often missed as asthma, that a chronic cough can be caused by asthma. And we can diagnose it with, we have special types of breathing tests we can do in the office. One that looks at airflow and one that looks at actual inflammation in the airways. So history and testing gives us diagnosis. And fortunately, there are many good treatment options, from environmental controls for allergic triggers to allergy injections, and even to highly specialized, complicated medicines that have become available in recent years.
Yeah,
and when you ask about curing, I guess the closest you can get to a cure would be if you did allergy injections, because that's giving tiny doses of the natural extracts to which you're allergic, and you increase that dose over time. So slowly your body kind of ignores the stuff instead of having this big inflammatory reaction. So most people on allergy injections feel better with less medicine, and they're far less likely to get worse.
Yeah, I know the medications, the treatments have come a long way, and I know kids, that was always a big deterrent for some kids to play sports because they had asthma, but things have changed a lot with that.
And if they are holding back from sporting events and such, it's probably because their asthma is not really controlled. It's so disheartening when I know there are so many people out there who are getting used to living at a lower level. They think that using their rescue inhaler, a few times a week, that's no big deal. But really, that's a marker of not being well controlled. Patients, a quick and easy test they can consider is the rule of twos. So if they have symptoms or use their rescue inhalers more than a couple of times a week, or if their asthma awakens them from sleep more than once or twice a month, that suggests you should seek better care. But those with well-controlled asthma should participate in almost any sporting event, as long as they have the right plan in place.
All right, well, Doctor, thank you so much for joining us. And of course, you guys are taking new patients. Go visit them at 6615 Big Hollow Road in Peoria, Springfield Clinic. Give them a call at 691-5200. Dr. Eubanks, thank you so much for joining us.
Thank you.
All right, we've got more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.